So before vaccines, last school year, you'd get one positive COVID case and it would send a class or several classes into remote learning, a quarantine. Not this year. The rules have been changed. State Health Department is trying to minimize the quarantines that disrupt learning. Here's Victoria De Leon.
There are lower risk and higher risk situations.
The state health department issued new quarantine metrics for Colorado schools with one goal in mind.
To really try and increase the chance that our kids can stay in school and learn effectively.
Now, classroom exposures to COVID-19 won't always mean having to quarantine.
So when both parties, the individual that was infected and the individual that was exposed, were wearing a mask, other settings like routine testing occurring, low case rates, and those types of scenarios, we do feel that quarantine would not be necessary at this point for routine classroom exposures.
But here's what's considered high risk: counties and schools with vaccination rates under 70%. And communities with high transmission rates over a 7-day period. Take Tri-County Health, for example. They oversee more than a dozen school districts within Douglas, Arapahoe, and Adams counties.
Unfortunately, the transmission rate in communities is high at this time, so that is concerning.
For now, Tri-County will follow the state's guidelines, but will implement stricter ones if there's a school outbreak of 5 or more related cases.
So at that point, we will require quarantine for students, even in the classroom setting.
And just like everything else with the pandemic, things can change quickly.
Even though kids may not get as sick, they still do get sick, and there have been hospitalizations and even deaths. So we're really taking that very seriously, but are dedicated to keeping kids in school as much as we can.
So the state's metrics to avoid quarantine based on school vaccination rates could get a little tricky. Now, some districts track staff vaccinations, but not many track how many of their students are vaccinated. Tri-County says the best data they have is county-based vaccinations in the school-aged children. But again, who knows what schools they go to.
Yeah, and Victoria, there might be individual school kids that have specific risk factors that their peers don't, but we know that in general, young kids don't tend to have serious cases.
Yeah, that's exactly right. And I spoke to an immunology doctor with CU Anschutz who says even with the Delta variants, kids remain at low risk. Now, not no risk, but the risk is still very low. And for those too young to get a vaccine, he says it's really up to those who are eligible to help protect the kids who are not.
Victoria De Leon, thank you very much.